A Senate inquiry will soon investigate claims of serious mental and physical side effects among Australian military veterans given controversial anti-malarial drugs almost 20 years ago. Thousands of soldiers were given the drugs in a trial, most of them during their deployment in East Timor. A small number of veterans claim they continue to suffer from a range of debilitating symptoms, from anxiety to psychosis. Michael Atkin reports.
In the water I feel calm and relaxed, and yeah, I enjoy it. When I'm out there, my thoughts sort of go away and I just clear my mind and I get to relax a bit more.
Out in the ocean, Michael Bush feels his anxiety briefly wash away. On land, the Army veteran's life is a struggle. He's unable to work and has moved back in with his mum.
Michael lives with me because he can't live on his own. He doesn't have a memory. He writes everything down in a book. He finds it difficult to cope with everyday life.
Michael Bush believes an experimental anti-malarial drug he was given called Tafenoquine could have caused his severe problems.
I can tell them now the medication isn't safe. I've been diagnosed with PTSD, IBS and schizophrenia. I never had one of those before I was deployed.
Almost 20 years ago, Michael Bush was deployed to Timor-Leste to protect the Timorese from bloody retribution after they voted to end Indonesian rule.
A lot of people have been killed by the militia, and yeah, we were sent there to sort of stop all this. And when we first got there, it was pretty bad, yeah.
In Timor, the army was faced with a major malaria outbreak.
The issue there was our people deployed on doxycycline, our number one first-line drug. But in the first 5 months of that deployment, about 63 soldiers came down with malaria.
The solution was to trial two medications called Tafenoquine and Mefloquine, given to thousands of troops.
When I was first diagnosed with depression, for example, that was immediately after my exposure to Mefloquine.
Retired Army Major Stuart McCarthy was part of a Tafenoquine trial in Bougainville and was also given Mefloquine in Ethiopia.
I have chronic depression and anxiety. I also have some balance problems or rocking dizziness. I have hearing problems.
Well, we've known that Mefloquine, ever since it was discovered, has this problem that people who take it have what we call neuropsychiatric side effects.
The Turnbull government now accepts Mefloquine can cause 14 serious side effects, including suicide, schizophrenia and seizure. Defence argues troops consented to the trials after being told about Mefloquine's psychiatric side effects, and an inquiry by the Inspector General of Defence found the trials were ethical and lawful.
In retrospect, with what we know now, Mefloquine probably would not be a drug of choice for use in a deployed military situation.
Veterans want an upcoming Senate inquiry to determine if the medications could have caused lasting damage.
It's not just a question of whether we agreed to be involved in a drug trial. It relates to the question of informed consent. And so that question of informed consent is an absolutely key one.
Despite its acceptance of side effects caused by one of the drugs, Defence maintains Tafenoquine is not responsible for the health problems claimed by veterans like Michael Bush.
There is no evidence that we know of that links it to neuropsychiatric conditions.
Remington Nevin is a former US Army doctor based in Vermont who provides expert medical opinion about anti-malarial drugs.
Hi, Dr. Nevin. How are you?
Hi, Mary. Hi, Michael. I'm well, thanks. Yourself?
He believes tafenoquine is unsafe, and today he's giving advice to Michael and Mary Bush.
Can the symptoms of a brain injury from taking tafenoquine be mistaken for PTSD?
It's certainly very plausible that Australian veterans who were taking these drugs in East Timor during these trials could be mistakenly diagnosed with post-traumatic stress disorder when what in fact they're suffering from is poisoning by mefloquine or tafenoquine.
Dr. Nevin argues there is evidence tafenoquine has dangerous side effects.
In recent tests conducted at Walter Reed Army Institute of Research, tafenoquine was shown to be more neurotoxic than mefloquine. There's every evidence based on published studies that tafenoquine shares the same liability to these neurotoxic effects.
I certainly would take tafenoquine because of its great safety profile and because of its ease of use. Hey Sean, how's it going?
Professor James McCarthy leads a tropical medicine research group that specialises in drug development for malaria. He rejects Dr. Nevin's claims, citing the recent finding of the US Food and Drug Administration that despite having some concerns, tafenoquine is safe.
We know that tafenoquine's been given to more than 4,000 people, and these side effects have been extremely rare outside of people who have pre-existing mental health conditions.
He believes tafenoquine could save many lives and should be approved for use in the US and Australia.
It's going to provide new opportunities for control of Plasmodium vivax infection, which is the major parasite that causes disease across the Pacific in places such as Papua New Guinea, the Solomon Islands, across Indonesia.
However, pharmaceutical company GlaxoSmithKline has received reports of possible long-term central nervous system effects from Australian soldiers. The company told US authorities that 18 soldiers had reported anger outbursts, confusional state, hallucinations, and a role for tafenoquine cannot be excluded.
I think it's important for the Australian military to conduct universal screening of these study subjects for a history of symptomatic exposure during their use of these drugs.
Substantiating a link between mefloquine.
Stuart McCarthy has used freedom of information to discover evidence of the harmful side effects reported to the medicines regulator, the TGA.
This is a series of adverse event reports which show not only things like depression, anxiety, but even quite explicitly brain injury, and in a number of cases completed suicides in addition to attempted suicides.
Michael Bush believes tafenoquine has made him suicidal.
I've had to go to hospital, I think it's 3 times now for attempting suicide. So, yeah, it's not a good drug. It makes you feel real depressed.
The Defence Department declined 7:30's interview request, saying it is participating in the Senate inquiry and it would be inappropriate to comment while it's underway.
You can fish through here.
Oh, can you? Oh.
Michael Bush hopes the inquiry will give him the answers he desperately needs.
For what they've done to my health and other people that have taken it, you can never buy that back. It's destroyed my life.